Ahmed, one of your surgical team taking caring of you today. May I confirm your name and age, please?
Yes, I'm Lisa, 68 years old.
Nice to meet you, Mrs. Lisa. Could I call you Lisa, or do you prefer another name?
No, that's okay. Yes.
Okay. So, Mrs. Lisa, could I use paper and pen to take some notes while we talk?
Yes, sure.
Okay, Mrs. Lisa. Thank you for your generous. Okay, so I know that you have came today for your pre-operative assessment for your hip replacement. Is that right?
Yes, yes. Yes, please.
Okay.
Yes.
So I would like. Okay, so I would like to know how this pain affected your life, and
It has really affected my life. Pain has become so unbearable. I can hardly walk now. It's really, really painful.
Oh, I am very sorry for this, Mrs. Lisa. I assure you that after the operation, you would be good. We have a very skilled surgeon who would take care of you. Okay, so I would like to ask you some questions related to your general health that would
Okay.
help us assess you before the operation. Okay?
Good. Yes.
Okay. So, Mrs. Lisa, do you have raised blood pressure?
Yes, that's what they say. I have high blood pressure.
Okay. It is controlled.
No, sometimes they tell me that it's not controlled, and I feel headache as well.
Okay, I'm very sorry for this. Can you tell me the medication you took for this?
Oh, doctor, I don't remember. I've got so many medications, and this social worker, she comes and she just makes me eat them, so I don't know the names.
Okay, it's fine. I could revise your record. Okay. Did you have any heart problems like chest pain?
Yes, nowadays it's becoming too much. I don't know what makes it start, but it really, really, I have chest pain, and it becomes so worse that I can hardly do anything.
Oh, I am very sorry for this, Mrs. Lida. I can make an appointment for you for the cardiologist so we could make sure your heart is good. Okay?
Okay, okay, thank you.
So, Mrs. Lida, do you take any blood thinners or regular medication for your heart?
Yes, yes, I do take blood thinning medications.
Okay. Did you know the name or the dose?
It's one small heart-shaped medicine, Lisprin or aspirin or something. I don't know, 75 milligram.
Okay, Mrs. Lida. Okay. Okay. So, can you tell me the last time you got a chest pain?
Oh, it was just yesterday morning. I had so much chest pain.
And what happened and how did pain go away?
They've given me some sprays. I just spray it under my tongue, and then after 2-3 hours, it becomes little bit better.
Okay, this is relieving, Mrs. Lisa. Okay, do you have diabetes?
Yes, yes, I have since so many years.
Okay, is that controlled?
I don't know. Maybe, yes.
Okay, do you have asthma, Mrs. Lisa?
Yes, yes. And I take inhalers for that.
Okay, okay. So, uh, d- uh, so do you smoke, Mrs. Lisa?
Yes, occasionally, I get bored of all my illnesses, then I think, okay, it's better to smoke little bit. Now this new pain has started in my thigh or in
Okay, what
my
about
joint.
alcohol?
Yes, occasionally when all my friends gather around, we have a drink or two, maybe. Yes.
Okay, okay. What do you do for a living, Mrs. Lisa?
I'm a pensioner, I've been teaching all my life. Now it's about time that I should take little rest.
Okay, do you live alone or with someone?
Yes, I live alone.
Okay, do you have previous surgery?
No, I've never been operated before.
Hello.
Yes, I've never been operated before. This would be my first time.
Okay, Mrs. Lisa. Do you have any allergy to any
No,
drugs or
no,
food?
no, not that I know of.
Okay. Okay. Do you have any problems with anesthesia?
No, not that I know of. I've been never operated before. Okay.
Okay.
Please summarize your
Do you
history
take
now.
any other?
Time has gone. Please summarize your history now.
Okay, so I have Mrs. Lisa, 40 years old, who is diabetic, hypertensive, asthmatic patient who came today for her preoperative assessment. On assessment of her heart, she has a heart. She has ischemic heart disease for which she take blood anticoagulant. She didn't remember exactly the name. She also didn't remember exactly the names of her antihypertensive, diabetic, or asthmatic medication. She is a smoker. Uh, uh, she she is not. I should say at the first that she is not a smoker. Okay, she is not a smoker or alcoholic. She never her surgical history is free. She has no documented allergy. And for this is what I could take from here.
Yes. So, according to your opinion, do you think she should go ahead and she should be operated upon? Because
No,
yes,
it is an
why?
elective.
Yes.
She she need to optimize the first for her cardiac, diabetic, hypertensive, anticoagulation drugs.
Okay. So, how would you conclude? What investigations would you ask for her?
Okay, so I would ask for her ECG, echo, for her cardiac and INR and coagulation profile. For her chest, I would do chest X-ray, EPG, and also I would for her diabetes, I would do hemoglobin A1C, and I would conf- con- make a multidisciplinary team. So I would make make her appointment with a cardiologist, with a chest doctor, optimization, and okay, and
And
this.
a lung doctor as well for further checkup of her
Hello.
lungs. For her lungs as well. Are you getting?
Yes.
Yes. Okay. Right.
For yes,
And right. And in case she needs to be operated, how would you take care of her anticoagulants?
Okay, I would for taking caring of her anticoagulants, I would stop her warfarin 5 days before the operation and start low molecular weight heparin by injection. And when her coagulation profile labs are good, I would stop the low molecular weight heparin from 12 to 18 hours before the operation, and once it's, repeat her coagulation profile, and I would start low molecular weight heparin, and once she is preparable to oral intake, I would start warfarin for 5 days. Then I would do another coagulation profile, and if it is good, I would stop low molecular weight heparin and continue on warfarin as before the operation.
Okay, good. If time would have allowed you, how would you have completed your history?
Hello?
Yes. If time would have allowed you, how would you have completed
Okay.
your history?
Okay, I would ask about her systematic check for her brain, her chest, her tummy, her urinary tract, and her peripheral and her periphery. And I would make sure that all concerns about the operation is gone, and I would take a bus. Yes, this.
Yes, and then idea, concern, and expectation.
Uh,
Her,
uh,
yes.
Yes, but I wanted to ask, is that arrangement of asking is good to ask first about the positive medical history in the STEM, then I would ask about social history and previous surgical and allergy
First,
and all of this, and then I
yes,
would do
yes.
systematic check.
Yes, all this is right. But in the beginning, you forgot to ask about the presenting complaint because patient has pain. Patient was saying, I have too much pain. You should have asked on the scale of 0 to 10, how would you grade your pain? See, how severe is the pain? Do you always have the pain? First, presenting complaint, then comorbidities or the past medical histories or the medical history, then surgical history, because you asked everything except for the presenting complaint.
But as I told, I shouldn't be consuming in the analysis of pain as she is already analyzed before.
Yes, yes,
Or
she is.
what?
But still, quick 2-3 questions you should ask because this is your assessment that she has pain
Okay,
or no
so
pain and what her current situation is, right? So in order to establish that she has pain, okay, but her current condition is like this, but you cannot just ignore, okay, you are not ignoring her pain, but you're not ignoring her situation as well. Just because she has angina, recurrent angina, she cannot be operated right now. So even if she has pain, she would have to bear it. But you have to at least establish it that how much pain she has. Okay, fine. Now moving on to the next. Good.
okay.